Thank you all. And so to clarify, in 2010, I was the dietitian for the Tactical Human Optimization, Rapid Rehabilitation and Reconditioning Program, otherwise known as THOR 3 for the US Army, here at Fort Bragg. And so I left that post in 2012. I was a civilian contractor for that dietetics position. And so now I'm more involved in research and have done research continued at Fort Bragg and also research with the British military. I was working in the United Kingdom for 2 years and did a lot of research with them. So I'll present some of that along with my own, but since I've been in a lot of the research and less on the practical side, I did have some background in practical applications. So I'm going to give you some of the mechanisms and background for some of this information, and then Kate's going to follow that with like what are they actually doing and what are the things that she recommends as a dietitian working at Fort Bragg now. And so this is a lot reinforcing what we've already heard, but to put it in true literature, peer-reviewed format. We know that frequent deployments reduce dietary quality. So this is in the special operations community, but you can extrapolate that to the general conventional forces as well. And we've heard that presented in our last two speakers, that these deployments are definitely inhibiting proper dietary quality. Also, we know, this supports our last two speakers as well, when we've done blood measurements, we know that the omega-3 fatty acids, that their concentrations, especially DHA, the omega-3 most critical to TBI and brain health, is actually really low in all of our service members. So not just special operations, this research has been done in service members across the board. A lot of it's come out of USHU's, Uniformed Services University. And then Dr. Michael Lewis, who is a retired medical doctor within the Army, has done a lot of research as well. And he actually did a study with some blood bank and samples that they had showing that low omega-3 levels correlated with suicide in service members. And so here's just, I have an infographic. I did not make these. Somebody on Twitter makes really good ones. So this is recommendations just with omega-3 and how critical they are. And then some of my own research, along with Dr. Nick Behringer, has shown that vitamin D status is also really low. The role of vitamin D status in brain health is unknown, but it is linked to inflammation. And so we know that service members, as well as the general population overall, but especially service members, have really low levels of vitamin D status. And then Dr. Lewis's lab has also found in that same blood bank sample that the low vitamin D status was also correlated with risk of suicide. So that was that same general population that he did. So we know, we definitely know that most people are not getting adequate vitamin D, and that's actually why I spent 2 years of my life living on an island in North Wales, and I'm not exaggerating, and we did a lot of work. They don't get any sunlight, their latitude's really high. So we did a big clinical trial intervention looking at can we increase vitamin D status in the British military and the effect on performance and immune function. So our paper is out with performance. It didn't really show anything, but we did see some benefits with immune function, especially because they were all deficient going into it with their hepatitis B antibody response. And so what I'm going to present today is just a summary. I have kind of isolated, because it's a pretty short presentation, just a few conditions that are related to inflammation that we can target nutrition. But really what we want is, one, to meet our energy needs, which again are super, super hard to calculate. And I know there's a lot of research going on now, is a calorie a calorie? And the short answer is yes, it is. It's a metabolic unit of measurement. But the longer answer is how that is metabolized in your individual body and where it comes from is going to be different among different people. So it is a specific unit of measurement with raising, with 1 liter of water or 1 milliliter of water. I should know this, I teach nutrition. But it is a unit of measurement, but how it affects people is a little bit different. And also it's certainly going to be different whether it comes from a protein, a fat, or a carbohydrate, and the quality of that protein or carbohydrate or even fat. And so, like I said, we're going to isolate these conditions, but clearly we've heard a lot about omega-3s. Also, I'm going to talk a little bit about polyphenols and the anti-inflammatory polyphenols and some of the research that we have going on, actually within the North Carolina Research Campus through the App State Lab, looking at polyphenols. And so this is with traumatic brain injury. And so this, I recognize that this infographic is from concussion and football literature. But I pulled this up because there are some great studies that are going on right now with Texas Christian University and omega-3 fatty acids and some of the work that they're doing. And so, yes, a blast injury is different, but there's already very limited nutrition research in general on concussions, especially mild traumatic brain injury. Most of the nutrition's on more severe. models, and there's even less research with blast injuries. But I just point this out because we can look at where nutrition can affect each of these different pathways. So for example, we know nutrition affects inflammation. Apoptosis or cellular death can be affected by nutrition. Creatine is one of the nutrients that can be related to this hypermetabolism. So creatine helps regenerate ATP. The short-term hypermetabolism that's heavily reliant on glucose and a quick generation of ATP for fuel can be benefited by high creatine levels going into injury. And then after that, you actually end up with a hypometabolism, which is why there's some research short-term on a ketosis diet as well. And so we have a lot of different pathways, and I have them listed here, that we can really look at. Nutrition can iron in on each of these different pathways. And the short answer is it's not really one thing. It's probably an overall nutrition. So yes, omega-3s are great, and definitely we know people are really low in them, but we also want to have an overall well-rounded diet with rich in polyphenols, rich in protein sources, and meeting their overall energy needs. And so I've isolated here, this is from an infographic as well, all the nutrients that could possibly be involved in TBI recovery. And clearly, right on top is omega-3 fatty acids. And this isn't related to this specific population, but the NCAA, the governing body of all of our sports organizations, has actually just taken omega-3 off the banned list. And what that means is now athletic departments can provide this to all of their athletes, including football players or any other athlete. So that's a really recent thing. Previously, if a football player wanted to take omega-3s, he either needed a medical prescription or had to purchase it on his own. Now, as of in like the past few months, the NCAA has released those guidelines. So now you can give your players or any athletes supplements without treating it as a drug. And so I isolated, this is from Texas Christian University and their football players. And what they looked at was treatment with DHA at the preseason and throughout the season at these 10 different points. And here is the really interesting part. What this is an NFL, it's a neurofilament that they measured. None of these players had concussions. Not one of them had concussions from this research. What this is showing you is that if they were treated with DHA, their small hits, and they measure this NFL in their brain function, on this neurofilament, they measure the concentration. These small hits actually gave them a lot of stress overall. And if you look at doses, and so if we look at the dose amounts and what was the most beneficial, we actually see that 2 grams a day was really sufficient with DHA within these football players to really reduce the concentrations of this NFL, this neurofilament. And the benefit that we see here is that, again, none of these players actually had concussions. It was just these small repeated hits that added up over time. And so that's a big thing that could be extrapolated to the military as well, these small hits that may not register as a concussion or may go unreported, an actual concussion or a mild traumatic brain injury that is unreported. And so I just had that back on. So Kate's going to go through some of these nutrients and what she would recommend with somebody either pre-concussion or post-concussion. But as I have mentioned, and there's some pretty good research on this as well, creatine is actually really beneficial. But the thing with creatine is you have to have it prior to any injury because you need those phosphocreatine levels stored in the brain. So post-injury, it's not going to be as beneficial. And there's a lot of really great literature looking at that with hypoxia. So under low oxygen conditions, that creatine can be really beneficial to brain injury. And so then I just want to transition a little bit with musculoskeletal injury. So this is a very common injury, especially across service members. So here we have a sample of SEALs, and it's just looking at overall all of their use injuries. 34% of them were classified as overuse musculoskeletal injuries. And you can just see here's the distribution across lower and upper extremities and spine and torso, pretty evenly distributed. Pain, spasms, ache, issues with their tendons, either myopathy, pain, swelling. So you can see across the board here. And the nutrients that may be beneficial, again, we see omega-3 on this list. We actually have a study ongoing now at the North Carolina Research Campus looking at turmeric and if that's going to be beneficial with exercise-induced muscle damage. Kate has some information on that as well as garlic extract. And then here's some research coming out of California with whey protein and gelatin and vitamin C. And one of the things we see, we know that whey protein, which is really high in the amino acid leucine, is really beneficial post-resistance training, that really stimulates muscle hypertrophy and muscle protein synthesis. Well, they showed that in the actual tendons, whey protein also helped initiate tendon hypertrophy. So that whey protein in this post-strength training, whey protein in combination with strength training, helped repair the tendon. And there's also research out of that lab looking at gelatin plus vitamin C with a tendon injury, that combining those two together can help reform the collagen in the tendon and reform that as well. So we know that a lot of these dietary factors are going to be related. And then glutamine specifically is also an amino acid. We all make it. It's the largest circulating amino acid in our gut. So it's circulating throughout the body. It's the main fuel for the intestinal tract. And so that really brings us to gut microbiome. And we've heard a little bit about this today and the Mediterranean diet. And there's a lot of literature that supports the Mediterranean diet for brain health. And a lot of that is linked to how the brain is linked to the gut microbiome. So here I have some literature comparing your standard Western diet, high in sugar, high in saturated fat, high in refined grains, versus a more Mediterranean diet, high in long-chain polyunsaturated fatty acids, such as omega-3s and fish oils, high in polyphenols that you're going to get from, among other things, but especially fruits and vegetables, and high in dietary fibers and other vitamins and minerals. And we see that when you consume more of a Mediterranean-based diet, also high in choline. Choline is sort of classified as a B vitamin now. It's found in eggs, specifically the yolks. So if anybody's following the new egg studies, it's been the new, I don't know if you guys are, my class sent it to me on Twitter. There's a new egg study saying basically that for every egg you eat, your chances of dying of cardiovascular disease are much higher. That study has been heavily, heavily criticized. And so choline is a really important component found not just in eggs, but in the yolk of eggs. And that is actually linked to better GI health and better gut health, better brain function as well. And to some extent, heat illness. And so we know that the microbiome is really, really important, and that what we eat really affects it, and it also affects the pH. So what people don't understand, most absorption doesn't actually happen in your stomach. It happens in your small intestine. In your intestinal tract, and then what's not absorbed in your intestinal tract passes through the colon. And so all of that is tightly regulated, and what you eat has major effects on the health of those pathways. Like I teach a metabolism class. We just read an article, I had my class review on artificial sweeteners and how it affects your gut microbiome, and it's linked to type 2 diabetes. And we have some pretty strong evidence there that while you may not absorb the calories, it does negatively affect the bacteria in your GI tract. And also the more fruits and vegetables that you eat, the more beneficial bacteria that you grow in your GI tract, which then takes the space and can fight off any of the negative bacteria. And also, not only is it linked to brain function, it's linked to immune health. So I have really ended up in the last few years of my life studying a lot with immune function. So that was not my original intention. I did a lot with bone and athletics, but now the past few years I've been doing a lot of work in immune function. That's one of the things I did over in the United Kingdom a lot. We were really looking at immune function, common cold, and their response to hepatitis B vaccination and their ability to produce antibodies. And so this is work, this paper was just published earlier this year by myself and Dr. Neiman from App State, a colleague in exercise science at App State. And so here's the good and bad news with exercise and immune function. I'll get to nutrition in a moment. The good news is moderate exercise has a great beneficial effect on your immune function. By moderate, we mean you're like 45, 50 minutes a day, go for a jog, go to the gym, your like kind of daily exercise routine. The bad news is heavy exertion exercise, such as done in a lot of military service members or elite athletes or even collegiate athletes, actually has the opposite effect, and that's what this J curve is. And we see this elevated risk in upper respiratory infections among some other illnesses. So it actually negatively impacts your immune function. And this figure over here is what this is showing you, is a nice moderate exercise actually mobilizes a lot of your immune cells. And even though we have a small release of IL-6, which is an inflammatory cytokine, actually that doesn't cause extensive inflammation. Well, so where we're looking at this is about over 90 minutes of vigorous exercise. So actually there's a bunch of studies, so post-marathon, the next 2 weeks, people are at really high risk of illness. So even with recovery, if you do a really heavy bout of exertional illness, you're still at risk of, your immune function is still compromised, even under recovery time. So even with that, you still have a compromised immune function for, we don't know exactly how long. It's anywhere from like 2 days to 2 weeks. So generally a heavy workout is over 90 minutes of vigorous exercise is what we've defined a lot in this paper. And so your immune function is going to be compromised, and I'll show you this next one. It's going to be compromised for a number of hours. So not necessarily for days, but this is after, so what we have in this study is from cycling for about, it's 75-kilometer cycling trial. And so that's going to range to a little over 2 hours, depending on the participants. Not me, these are elite cyclists. And so what we see here is without any other nutritional intervention, we see elevation for about 3 hours. So from one bout of a pretty vigorous exercise, not a marathon, but a high intensity exercise training, you're going to have about 3 hours of altered immune function. So if you just have explosive, you're not going to have much transient immune dysfunction. That's not going to negatively impact your immune function. It will cause muscle damage. So you may have like some eccentric muscle damage, delayed onset muscle soreness, but that won't negatively affect your immune function in the way that this does. This is more sustained. Correct. So what we can do, though, is if you can't alter the training, what you can do is alter the nutrition. And this is really where it comes into with acute carbohydrate ingestion. And that's what also this figure is showing you is with, there are 2 different types of bananas and a sugar Gatorade compound. But basically what we're showing you here is with carbohydrates consumed during the training, not only do you need those as a fuel source, it also helps reduce that inflammation so you don't have that sustained inflammation post-exercise. So the solution here is not stop training at a high level. It's consume carbohydrates during training to reduce, and this is IL-6, which is an inflammatory cytokine, to reduce that sustained inflammation. So we're not really fighting it. We're just consuming carbohydrates, 1, like I said, as a fuel source, and 2, to help counter this exercise-induced alteration. And we see the same thing with a lot of white blood cells. With natural killer cells are elevated for about an hour or 2, and some of the other leukocytes up to about 4 or 5 hours. And so overall, in summary, again, energy, and this is the hardest thing to calculate, even practicing dietitian, it's really hard to say you need this many calories a day. And then it's even harder for people to calculate that on their own. So that's a hard thing to balance, but it is important that you want to be weight stable. And the other thing is it changes. So if you have a high workout day, it's going to change versus a recovery day. That is going to change your carbohydrate and protein ratios and overall nutrients. So that you want to have that in a pretty good balance, but also really emphasis on grains, especially whole grains, as we've heard, fruits and vegetables, which people don't get enough of, even in America, much less on deployment. And then so carbohydrates, polyphenols, carbohydrates during exercise are going to be really beneficial. Again, not just as a fuel source, but also to counter that inflammatory response. And then we've heard a lot about omega-3. So most people, as I presented earlier, just don't eat enough. So that's probably why they need to supplement, because we're just not eating a diet that supports our omega-3 needs. Protein to support amino acids, hydration in the heat. Avoid excess alcohol intake. I know that's never a fun one, but that is linked to negative immune function and GI health. And then the other thing is, I didn't include this slide, but one of the things we did with the British military was look at sleep. And I actually was the one on the paper, and we found that the recruits over 13 weeks of time, if they slept less than 6 hours a night, they had 4 times the risk of a physician-diagnosed upper respiratory infection versus those who slept 7 hours or more. And so that was our study. And then there's other research, and this is kind of interesting for military as well. And I know military is really focusing a lot on sleep, and that's a little bit of a different topic, but there's a lot of research to support. So you may be one of those people who say, I don't need more than 6 hours sleep. I can get by on 5. The research says, yes, you can, but your immune system can't. And so what they found is people can adapt, and so they can feel okay on a day-to-day basis, but your immune system never is fully optimized. So your immune system is always going to be compromised under about 6 hours of sleep on a regular nightly basis, even if you feel alert and you feel like you can do what you want to do. So there's a couple studies that support that, and ours showed that you do have higher risk of infection. Generally, you want at least 7 hours of continuous sleep. There's other research to support if you can take naps, that can help fight that off. So if you can take naps, that can account. If you don't get enough sleep, the naps will help. That's a hard area of research because it's also hard to measure continuous sleep. you know, if people are interrupted in different scenarios. So with that, I think I did a nice job setting up like kind of the background, and then Kate's going to come in and tell us more about the real practical applications.